Paulo, we'll get to Brazil in just a second, but Cuba, do you think this decision to send Cuban doctors abroad is something they often do, but do you think now it'll backfire when they're crucially needed back home?
Well, the Cuban doctors that were in Brazil already have been called to help with the pandemic in Brazil. We had a number, hundreds of them that had come in previous governments, and they were not being allowed to work by the very conservative government we have at the moment. But that decision has been reversed because we do need them. As far as Brazil is concerned, I believe that the assistance and the presence of the Cuban doctors that are in the country is welcome.
All right, let's talk about South America. Many thought the region might be spared or perhaps delayed from coronavirus because of weather, and now we're seeing the coronavirus come on strong there. Talk about some of the hardest hit spots and also the difference in responses that we've seen from El Salvador's president taking action very early on compared, for example, with Brazil's rather delayed response.
Yeah, Brazil has had a delayed response in part because the president President Bolsonaro leads the group of deniers. He has said that this was nothing more than a bad cold, that Brazilians don't catch those things, and the response has come from two sides. Governors, 25 of the 26 governors we have in Brazil had responded quite forcefully, trying to isolate the president politically. The healthcare infrastructure in Brazil. Brazil has a tradition of public health professionals that have responded very effective against things like HIV/AIDS, where they are taking the lead, but obviously having a leader that works against their purpose doesn't help. The death toll in Brazil has just surpassed 100 of 3,500 cases that have been notified. The fear is that this could go in a very, very rapid progression. And Brazil obviously is vulnerable. There are lots of places in Brazil, especially major cities, as you have the slums and very concentrated populations where it's very difficult to do isolation. But public health doctors have emphasized that the best solution is to obviously isolate people that are older, people that are obviously vulnerable, and deal with the crisis in that way. The governors, as I said, have taken the lead, and the public health professionals in Brazil are also in the forefront.
Paulo, much of the region was struggling economically before all this. What sort of economic damage do we expect in the long run?
Well, the immediate damage is quite substantial. As you said, the region was already in stagnation, very low rates of growth, economic growth, and now probably already in recession, very exposed to the impacts of the global economy. So each government will have to decide what is the best strategy. There doesn't seem to be very much of a good coordination outside of the public health professionals communities that is reacting via the Pan American Health Organization, is a subdivision of the World Health Organization, and some coordination between governors. In the case of Brazil, with the presidents of the neighboring countries. Brazil has 8 of those. And so that is where we can trust that there will be some efficacy in the response. But as you mentioned in your question, Latin America in general, Brazil in particular, I believe also Mexico, where the president is a denier, could face very, very serious consequences.
All right, Paulo Sotero from the Woodrow Wilson Center in Washington, thank you.